With the knee joint, there are seven supporting ligaments. So we're going to have a look at those now. So there's the patellar ligament and 2 popliteal ligaments that are posterior, the anterior and posterior cruciate ligaments, which are actually inside the joint capsule. So ACL or PCL, so ACL, anterior cruciate ligament, a common knee injury for athletes where they have stopped suddenly. Their foot is stopped, but the rest of their body has kept moving, and it has torn the anterior cruciate ligament from it being attached to the other bone side. So they'll need surgical repair of that. You've also got the tibial collateral ligament on the medial side and the fibular collateral ligament on the lateral side. So let's have a look at those now. So we've got the diagrammatic view. We're looking at the anterior view, so looking front on at the knee joint. You can see that in the top part of the picture we've got the femur, and the bottom part of the picture we've got the tibia, and on the left side there we've got the fibular head. Remember, as I said, we've got bones that are joined together by ligaments. And you can see here that we've got the quadriceps tendon, which is coming from the quadricep muscle when it hits the patella, and then from the patella, which is now a bone, the patella is joined onto the tibia via the patellar ligament. Now we're looking at the posterior view, which looks a little more complicated. Again, you've still got the femur in the upper part of the picture and the tibia and the fibula below. Here we've got bursas, which are lying underneath the muscles, the gastrocnemius muscles, the lateral and the medial heads, in order to provide friction-free movement of the muscle whenever the person is moving their knee and walking. Now we're looking at the bones with all of the muscle and tissue removed. Again, you can still see the femoral condyle. So here the person, it's looking at the knee joint as if the person is sitting down, and the patellar surface of the femur is right on view. So the patella has been removed, and you can see you've got nearly all of the articulating surface of the femur showing. And if the person was to stand up, that lateral condyle would slide under and the patellar surface would slide to the front. You can see there on view you've got the posterior and the anterior cruciate ligaments, which cross over to provide extra stability for the knee joint. You've got the lateral and the medial meniscus, which help in articulation of the condyles of the bones to provide extra cushioning. And you've also got the fibular collateral ligaments and the tibial collateral ligaments. So lots of ligaments providing stability for the joint, but still it gets injured. Here we are looking at the posterior view. So this is a deep posterior view. You can see here the anchoring points for the posterior cruciate ligament and the anterior cruciate ligament. So if these were ruptured, then there wouldn't be much stopping the femur from moving off the surface of the tibia. So you would have an unstable joint, which is why they leave the sporting field as soon as they have a knee injury, because their joint is unstable. So anybody with a disrupted ACL is unable to stand and weight bear without the fear of their knee giving way.